What if one of the two foods I'm about to describe is in your kitchen right now? Something you have eaten your whole life, something you consider perfectly healthy, and every time you consume it on the same day you take your blood pressure medication, it is either doubling the drug's effect in your bloodstream or quietly canceling it out entirely. Not occasionally, not under unusual circumstances. Every single time. For adults over 60 taking antihypertensive medications, and that is a significant portion of everyone watching this is not a theoretical concern. It is a documented, physiologically specific, and consistently underexplained drug-food interaction that I have seen cause real harm in clinical practice. Before you sit down to your next meal, you need to know what I am going to tell you. Might worry because the science behind these two interactions is specific enough and serious enough that it changes what you do in your kitchen today. My name is Dr. Sarah Envem. I have spent 16 years in cardiovascular medicine and preventive health working specifically with adults over 60. A significant portion of my patients are on one or more antihypertensive medications, calcium channel blockers, ACE inhibitors, ARBs, diuretics, or beta blockers. Most of them are managing their medications carefully and responsibly. And yet, years ago, I began noticing a pattern I could not explain through medication noncompliance alone. Patients whose home blood pressure readings were erratic, sometimes too high, sometimes alarmingly low, despite consistent medication use. When I started asking detailed questions about diet, two specific foods came up again and again. Nobody had connected them to the medication. Nobody had asked. This video contains no products, no commercial agenda, and no exaggeration. Everything I share is grounded in published pharmacological and clinical research. Where the evidence is strong, I will say so clearly. Where it is limited to certain drug classes, I will be precise about that too. What I want to give you today is something a standard medication review appointment rarely has time to cover. Here's the foundational issue that most people taking blood pressure medication do not fully understand. And it is not their fault, because it is rarely explained. Every medication you swallow travels from your digestive tract into your bloodstream through a series of biochemical processes. Among the most important is a family of enzymes called cytochrome P450, CYP450. These enzymes are your body's primary drug processing system. They break down medications at a controlled rate, determining how much of the drug reaches your bloodstream, how potent it is, and how long it stays active. When this system works normally, your prescribed dose delivers the intended effect. When something disrupts it, the dose either overshoots, delivering dangerously elevated drug levels, or undershoots, leaving your blood pressure uncontrolled. Now, here is where age matters specifically. First, liver metabolism slows with age. Research published in Clinical Pharmacokinetics has documented that hepatic blood flow and liver enzyme activity decline progressively after 60. This means that the same dose of a medication already stays in the body somewhat longer in older adults than in younger ones. The safety margin between a therapeutic dose and a toxic dose narrows with age. Any external factor that further disrupts enzyme metabolism, a food, a supplement, an herbal tea, has a proportionally larger effect in an older body than it would in a 35-year-old. Second, kidney clearance also declines. Many antihypertensive medications or their breakdown products are cleared by the kidneys. Research in the Journal of the American Geriatric Society has consistently documented declining glomerular filtration rates after 60, meaning drugs and their metabolites exit the body more slowly. The result is a longer window during which a drug-food interaction can cause drug levels to accumulate above the intended therapeutic range. Third, polypharmacy increases interaction risk. Adults over 60 are more likely to be taking multiple medications simultaneously. Each additional drug creates more opportunities for competitive interference at the enzyme level, meaning a food that disrupts a shared metabolic pathway can alter the effective dose of several medications at once. I want to pause here. If you take blood pressure medication and have noticed readings that seem unexpectedly high on some days and lower than expected on others, without changing your dose or missing a pill, type yes in the comments right now. If you have ever felt dizzy, lightheaded, or unusually fatigued on a day when your medication seemed to hit harder than usual, type yes. Because what I am describing is the likely explanation for a pattern many people have noticed but never been given a reason for. What accumulates silently over years of unrecognized drug food interactions is cardiovascular instability, blood pressure that swings unpredictably, placing repeated mechanical stress on arterial walls, increasing the risk of events that a well managed medication regimen is specifically designed to prevent. The medication is present, the management is incomplete. Carol is 68, a retired pharmacist from Florida, which made it particularly frustrating that nobody had identified what I was about to explain. She had been on amlodipine, a calcium channel blocker, for 4 years to manage hypertension. Her prescription had been adjusted twice because her readings were inconsistent. Some mornings, her blood pressure was well controlled. Other mornings, it was markedly lower, accompanied by dizziness and a sensation of her heart beating too slowly. Her cardiologist had attributed the variability to natural fluctuation. When I asked Carol to describe her morning routine, she told me she drank a large glass of fresh grapefruit juice with breakfast, followed immediately by her medication. She had a grapefruit tree in her garden and considered it one of the healthiest things she did each day. I explained the mechanism, which I will walk through in detail shortly, and asked her to eliminate grapefruit entirely and substitute orange juice. Within 4 weeks, her morning readings had stabilized, the dizziness resolved, and her cardiologist reduced her dose at her next review. She told me, "I am a retired pharmacist. I counseled patients on drug interactions for 30 years. Nobody ever told me about grapefruit and amlodipine. I feel like I should have known this." This was not a miracle. This was Carol's body responding to better conditions. Conditions she had simply never been given the information to create. Before I name the two foods, I want to walk you through 3 specific patterns that are making this problem worse for adults over 60. Understanding the mechanism is what makes the change permanent. Grapefruit, including grapefruit juice and related citrus fruits like Seville oranges and pomelos, contains compounds called furanocoumarins. These are potent inhibitors of CYP3A4, the enzyme responsible for metabolizing a significant number of cardiovascular medications, including calcium channel blockers such as amlodipine, felodipine, and nifedipine, as well as certain statins. When CYP3A4 is inhibited, the medication is not broken down at its normal rate, and drug levels in the bloodstream rise well above the intended range. Research published in the Canadian Medical Association Journal documented that even a single glass of grapefruit juice can inhibit this enzyme for 24 to 72 hours. The effect is not brief or proportional to the amount consumed. It persists across the entire day. Real black licorice, products containing actual licorice root extract or glycyrrhizin, acts on the kidneys in a way that directly counteracts several antihypertensive drug classes. And glycyrrhizin inhibits an enzyme that normally prevents cortisol from acting on mineralocorticoid receptors in the kidney. When this enzyme is blocked, the kidneys retain sodium and water and excrete potassium, raising blood pressure and directly opposing the action of diuretics, ACE inhibitors, and ARBs. Research published in the American Journal of Hypertension and multiple clinical case reports have documented hypertensive crises and dangerous potassium depletion from regular licorice consumption in patients on antihypertensive therapy. Licorice root is also found in herbal teas, digestive supplements, and throat lozenges, often without prominent labeling. This is the pattern that allows the first two to persist undetected. Grapefruit is rich in vitamin C and antioxidants. Licorice has been used in traditional medicine for centuries. Neither feels like something that belongs in a conversation about drug safety, and so the connection is never made, not by the patient and often not by the prescribing physician either, because the appointment focuses on the medication, not on what surrounds it. Research in the British Journal of Clinical Pharmacology has found that food-drug interactions are significantly underreported and underrecognized in older adult populations. I know what some of you are thinking. I have eaten grapefruit my whole life. If it were really causing a problem with my medication, surely someone would have told me. Here is why that may not have happened. the effect is not always dramatic. A blood pressure reading that is lower than expected on some mornings can look like natural variability. Dizziness can be attributed to dehydration or standing up too quickly. The connection between what was on the breakfast table and what showed up on the blood pressure cuff is not visible without specifically asking. The damage is inconsistent and cumulative, and invisible without the right question. The question you need answered is not whether these foods are healthy in general. It is whether they are compatible with the specific mechanism of your specific medication. And that answer is coming now. The two foods are grapefruit, including its juice and closely related citrus varieties, and products containing real licorice root or glycyrrhizin. Eliminate both entirely if you are on any antihypertensive medication and replace them with safe alternatives. That is the core instruction. Here is the precise pharmacology behind it. Are for grapefruit. Furanocoumarins irreversibly inhibit intestinal CYP3A4 enzyme activity. Irreversibly means the enzyme is deactivated, not slowed, until your body synthesizes new enzyme protein, a process taking 24 to 72 hours. Research published in the Canadian Medical Association Journal identified more than 85 drugs with clinically significant grapefruit interactions, with calcium channel blockers among the most affected. The interaction raises drug bioavailability by a factor of 2 to 5 in some cases. Your body receives a pharmacological dose it was never prescribed. For licorice root, glycyrrhizin opposes your medication at the kidney level, causing sodium retention that raises blood pressure and depletes potassium, directly counteracting diuretics, ACE inhibitors, and ARBs. Research in the American Journal of Hypertension has documented clinically significant blood pressure elevation from regular licorice consumption, even at modest intake levels in patients on antihypertensive therapy. Both interactions are well established, replicated pharmacology. They belong in every medication counseling session for adults over 60. The fact that they often do not make it there is the reason this video exists. But this is only the first layer. What I am about to show you next multiplies every benefit I just described, and it costs nothing extra. Raymond is 71, a retired high school principal from Georgia. He had been managing hypertension with a combination of an ACE inhibitor and a low-dose diuretic for 5 years. His numbers were never fully stable. His GP had adjusted the doses 3 times. Raymond had become quietly convinced that his heart was simply more difficult to manage than other people's, that his body did not respond to medication the way it was supposed to. What he had not told anyone, not his doctor, not his wife, not his adult children who checked on him regularly, was that he had started keeping a blood pressure cuff on his nightstand. Every morning, before he got up, before he said good morning to anyone, he would take his reading. And then he would lie there in the dark, deciding whether the number was safe enough to start the day. Some mornings he lay there for 20 minutes. He did not tell his wife because he did not want her to worry. He did not tell his doctor because he was afraid they would change his medication again, and he was exhausted by the cycle of adjustments. When Raymond came to see me, I asked him to describe his daily diet in detail. He drank 2 cups of herbal tea every evening, a digestive blend he had ordered online for 2 years to help with post-dinner discomfort. I asked him to read the ingredient list aloud at his next appointment. 3rd ingredient, licorice root extract. I asked him to stop the tea and replace it with a plain chamomile or ginger blend. Over 8 weeks, his blood pressure readings stabilized in a way they had not in 5 years of medication management. His GP, reviewing his ambulatory readings, noted the improvement and held his dose steady for the first time. Raymond told me, I was lying there every morning taking my pressure like it was a verdict. Now I just get up. Here is the complete protocol. Every step has a specific purpose. None of them require a prescription, a specialist, or significant expense. This means grapefruit juice, including the small glass some people consider a health routine, grapefruit-flavored drinks that contain actual grapefruit extract, and related citrus varieties. Seville oranges, commonly used in marmalades, pomelos, and tangelos. Check your marmalade label. Check any citrus drink you consume regularly. The safe substitutes are standard orange juice, lemon juice, lime juice, and tangerine, none of which contain furanocoumarins at clinically relevant levels. If you skip this step, you may be consuming a CYP3A4 inhibitor every day without realizing it, which means your medication dose is functionally variable regardless of how consistently you take it. Check all herbal teas, digestive blends, detox teas, throat-soothing preparations, and traditional herbal blends frequently contain licorice root. Check any herbal supplement or adaptogen product. Check throat lozenges and herbal cough remedies. Look for licorice root, licorice extract, glycyrrhizin, or glycyrrhizinic acid. Note that deglycyrrhizinated licorice, sold as DGL, has had the glycyrrhizin removed and is generally considered safe. Products using artificial licorice flavoring rather than actual root extract are also generally safe. When in doubt, contact the manufacturer directly. Bring a list of every food, supplement, herbal tea, and over-the-counter product you consume regularly to your next appointment. Your pharmacist is specifically trained in drug food and drug supplement interactions and can review your complete medication list against your food and supplement intake. While this review should happen at least once a year, or whenever a new medication is added to your regimen. If you have been consuming grapefruit or licorice root alongside your blood pressure medication and you now stop, your effective drug levels may shift. Do not change your dose independently in response to this information. Discuss the change with your doctor and monitor your readings more frequently during the transition period. Let me tell you about Doris, 73, a retired nurse from Minnesota. Doris understood the grapefruit interaction clearly and removed it from her diet. What she did not do was tell her physician or monitor her readings during the transition. Her calcium channel blocker, which had been effectively overdosing her for months because of the grapefruit interaction, now began working at its true prescribed dose. Then her blood pressure, which had been artificially lowered by the elevated drug level, rose back toward her baseline range. She interpreted this as her medication stopping working and was frightened. When she came in, I explained exactly what had happened. Her readings were now reflecting the drug working as prescribed, not failing. Her dose was adjusted appropriately, and she was fine. "Nobody told me removing something healthy could change my numbers," she said. "Of course not, Doris, but now you know, and knowing means you can act safely. The total investment for this protocol is zero additional cost. It requires a label check, one conversation with your pharmacist, and a change to your grocery list. That is the entire financial commitment, assuming the interaction only applies if you eat grapefruit every day. The furanocoumarins in grapefruit inhibit CYP3A4 for 24 to 72 hours per exposure. This means consuming grapefruit even 3 or 4 times a week creates sustained enzyme inhibition with no clear recovery window between doses. Many people reduce their grapefruit intake thinking they have solved the problem. They have not. The interaction is binary for practical purposes, present or absent. If your medication is on the CYP3A4 interaction list, grapefruit needs to be eliminated, not reduced. Only checking obvious licorice sources and missing the hidden ones. Most people check their candy jar and conclude they do not consume licorice. The more common source in adults over 60 is herbal teas, digestive supplements, and throat remedies, products marketed for health benefits that happen to contain licorice root as an active ingredient. A thorough label audit, not a casual memory check, is what this step requires. Trying to audit your entire diet, review every supplement, research every ingredient, and schedule a pharmacist consultation all in the same afternoon after watching this video. Start with one thing. Tonight, check the label on every herbal tea in your kitchen. Tomorrow, look at your supplement bottles. The day after, look at your juice and citrus routine. Introduce one audit step every 2 to 3 days. Within 2 weeks, the complete review feels natural, and you have covered every relevant category without overwhelming yourself into inaction. Tonight, 2 things. Check the label on every herbal tea and herbal supplement in your home for the words licorice root, glycyrrhizin, or licorice extract. And look at whatever citrus product you drink regularly. Does it contain grapefruit, pomelo, or Seville orange? Write down what you find. This week, bring a complete list of your foods, teas, and supplements to your pharmacist and ask for a drug food interaction review against your specific medication list. This service is free at most pharmacies and takes approximately 15 minutes. It is one of the most underused resources available to adults over 60. If your pharmacist confirms an interaction, contact your prescribing physician before making any changes to your medication dose. Ongoing. Eliminate grapefruit and grapefruit products entirely if you are on a CYP3A for metabolized medication. Eliminate real licorice root products if you're on any antihypertensive therapy. Find and repeat your supplement and tea label audit anytime you add a new product to your routine. The 30-day challenge. Track 3 things each morning: your blood pressure reading, your energy level on waking, and any dizziness or lightheadedness during the day. Come back to the comments in 30 days and tell me what changed. I will read everyone. I want to say something to you directly. You are not broken. Some of what you have accepted as the unpredictable nature of blood pressure management is nutritional. And nutritional problems have nutritional solutions. I am not telling you that removing grapefruit and licorice root will replace your medication, cure your hypertension, or eliminate the need for ongoing medical supervision. Blood pressure management after 60 is complex and requires a physician's guidance. What I am telling you is this: the medication your doctor prescribed was designed to work at a specific dose through a specific mechanism. 2 common foods can quietly undermine that mechanism every day. Identifying them is a label check and one conversation with your pharmacist, nothing more. The people watching this video are not passive about their health. You are here because you believe that understanding what is happening in your own body matters. Not to frighten yourself, but to make better decisions with the information you have. I believe that too. If what I shared today was useful to you, I have one request. Think of one person in your life, not everyone you know, one person who takes blood pressure medication and drinks grapefruit juice or uses herbal teas regularly. One click puts this information in front of them. One person. If you are new here, subscribe. Every week, I bring you evidence-based cardiovascular and preventive health information designed specifically for adults over 60. Practical, honest, and grounded in what the published research actually shows. Before you go, leave one comment. Are you on blood pressure medication? Did either of these 2 foods surprise you? I read every comment personally because everyone watching this matters to me, not as a viewer, as a patient. Your body has not given up on you. Give it the conditions it needs to do that work well. Close-up of a glass of grapefruit juice next to a blood pressure medication bottle. Senior reading a herbal tea label in a kitchen. Pharmacist reviewing a medication list with an older patient at the pharmacy counter. Blood pressure cuff on a senior's arm showing a reading. A close-up of black licorice and licorice root. Doctor reviewing patient chart at desk in warm light. Senior replacing grapefruit juice with orange juice at breakfast. Display CYP3A4 enzyme with a brief definition when first mentioned in Section 3. Display the 2 food names, grapefruit and licorice root, as bold on-screen text at the moment of reveal in Section 6. Show the 4 protocol steps as numbered graphic overlay during Section 8. Display type yes in the comments on screen during symptom callout in Section 3. Split image. Left side shows a glass of grapefruit juice and a strip of licorice with a bold red X over them. Right side shows Dr. Envem with a direct, urgent, but composed expression. Bold white text overlay. Never mix these with your blood pressure pills. Subtext. Cardiologist explains.